everybody knows that running a school for children with special needs is not an easy one. It doesn't come cheap. I don't know for any part of the country, maybe they offer free services outside Nigeria, but in Nigeria here, it's not cheap. And the reason is not far-fetched because the Nigerian government has not shown any form of responsibility in that aspect.
In Nigeria here, they will only talk about the hearing impairment, the visual impairment, and the orthopedic disorder and all that, forgetting children with autism, cerebral palsy, Down syndrome, ADHD, and all learning disabilities and all that.
On the average, it costs you like 3 times the amount you train a regular student, a neuropsychiatric student in school, to train a child with special needs.
A child may be deficient in a particular area, probably social interaction, probably academic accuracy, but maybe super intelligence in another area.
Independent living is our goal for every child, no matter the level, the type, or the degree of the disability.
In Dewdrops, they are result-oriented.
Our dream here is to groom these children in such a way that they go into mainstream school and they won't be needing a shadow. They can actually stand and do what they need to do independently.
The foundational philosophy of what this thing means, what this child is dealing with, what it means is that it's demonic and it's spiritual, then that means society will not give them that opportunity to flourish.
Accommodation and modification is very important for children with a special need, and if you can have that, you will see that every child must be independent.
Most times I always say that it's not about what we think, it's about what works for the child. So you cannot say because my school does ABC. If this child is coming to my school, he has to do ABC before we can. Inclusion means you bend and tweak everything to suit the child's needs. It's always about the child and not about what you have planned or set your mind to do.
They organize trainings, not just for the teachers, even for parents. Now, what that means is that even if the teachers are good with what they do, the parents should also be equipped too with the relevant knowledge and how to deal with these children.
I think it's also on us as healthcare providers to be able to explain to parents the importance of actually bringing the child in for well-care checks, right? Also educating the public on childcare and the government actually making it part of, let it be covered under the insurance schemes and NHIS, actually routine maintenance follow-up. That's very important.
I have a dream that one day our government will be responsible enough to actually give free education to children with special needs.
Government should provide health care, affordable health care. A parent with a child living with special needs shouldn't automatically become a beggar.
I think government needs to work on also supporting schools that are into special need education, both financial support, material support, and personnel that are involved in these things so that we can get job done. Protecting
the rights of children with disabilities, making that also part of the our constitution and our laws, that those are important things that the government needs to do.
We need proper policies in place, and not just the policies, the execution, the quality control. We've had cases of children being abused in special centers and even regular schools. Provide opportunities for free and appropriate education, not just free, but appropriate education for children living with special needs.